Hi, I'm Cristina Headley from Equip for Equality. This video provides information about the movement to enroll most people in Medicaid in Illinois into managed care programs by answering some common questions. The information applies to people with disabilities, including older Americans with physical, cognitive, sensory, or mental impairments. First, if I am on Medicaid, do I have to enroll in a managed care program? If you are a senior or a person with a disability on Medicaid, you are generally required to enroll in coordinated or managed care. This means that you will have to choose a primary care provider through Illinois Health Connect or a managed care network depending on where you live. All seniors and people with disabilities on Medicaid living in Cook, DuPage, Kane, Kankakee, Lake, and Will counties, the Rockford region, Central Illinois region, Metro East region, and the Quad Cities region are required to be enrolled in a managed care network. Second, what about people with developmental disabilities? Adults with developmental disabilities, or DD, who are either in an institution or receiving services under the DD waiver, are exempt from mandatory enrollment in managed care. All other adults with DD, including those with both Medicaid and Medicare, are required to enroll in managed care. Third, what is Illinois Health Connect? Illinois Health Connect, or IHC, is a primary care case management program of the Illinois Department of Healthcare and Family Services, HFS, the state Medicaid agency in Illinois. When you enroll in Illinois Health Connect, you will have to choose both a medical home for all of your health care needs and a primary care provider, or PCP, who gets to know you well. Your PCP will refer you to specialists and testing. IHC will help you access services, find providers in your region, tell you what services are and are not covered, get disability and disease management services, make a request for a ride to your medical appointments, file a complaint, and answer your questions. When your area becomes enrolled in managed care, you will have to choose a network and you will no longer be in the IHC Primary Care Case Management Program. Fourth, are there different plans to choose from? There are currently 9 health plans or managed care in the state. You should have 2 different plans to choose from in your region. If you do not sign up for a network, you will be assigned to one. You can voluntarily enroll in a different managed care network, either a coordinated care entity or a managed care community network if this is a choice in your area. Fifth, what are care coordinators? Care coordinators are paraprofessionals who take on coordination responsibilities with backup from registered nurses, RNs, licensed clinical social workers, LCSWs, pharmacists, and other clinical care management staff. You will probably work with a care coordinator through your managed care network or a coordinated care entity. Sixth, what are CCEs, MCCNs, and ACEs? A coordinated care entity, CCE, and a managed care community network, MCCN, are provider-run organizations that include primary care doctors, hospitals, mental health and substance abuse providers, and social service organizations. When you enroll in a CCE or MCCN, you should receive all of your care in the network, and you will have a care coordinator to help you with your healthcare needs. Starting in June 2014, there are accountable care entities, or ACEs, for persons newly eligible for Medicaid. Like CCEs, ACEs must provide or arrange for patients to have a medical home in a primary care setting, which may include a primary care physician practice, community clinic, or other appropriate setting. CCEs and ACEs will provide referrals to specialists, diagnostic and treatment services, behavioral health services, inpatient and outpatient hospital services, rehabilitation or long-term care services, and referrals to community-based organizations. Seventh, I'm on both Medicare and Medicaid. Does that make a difference in my managed care network? Yes, if you receive both Medicaid and Medicare, you are known as a dual eligible. The state of Illinois received a grant from the federal government called the Medicare-Medicaid Alignment Initiative, or MMAI. The MMAI is an effort to reform the way care is delivered to people eligible for both Medicare and Medicaid services. If you live in the greater Chicago area or central Illinois, you will be able to enroll in a managed care organization, or MCO. The MCO will take care of all your medical needs, including long-term care services and support. There are currently 6 MCOs in Greater Chicago and 2 in Central Illinois serving the dual eligible population. If you do not choose a plan, you will be assigned to a plan. You will have the opportunity to change plans if you are not satisfied with the one you choose or the one to which you are assigned. If you are receiving long-term services and support, you must enroll in one of the MCOs for those services. If you are not receiving long-term care, you may elect to opt out of an MCO. For more information, please see the resources listed below and on the fact sheet associated with this video. You may also contact Equip for Equality at equipforequality.org.